Well, many thanks and welcome to this year's Global Innovation Summit. And this year's summit is in so many ways a demonstration of innovation in action. It's come against the hardest of backgrounds, the most difficult of years, the most challenging of conditions. And yet, innovation has allowed a summit about innovation to go on. So we know the context. The greatest pandemic and health threat since the Spanish flu. Arguably the most difficult year in world history since the Second World War. And yet, through all of it, we have seen that innovation has been the key to saving lives and protecting lives. So what I want to do is to explore the theme of this topic and this subject before answering questions with Dr. Khan by setting out our strategy and to show the way in which innovation has been weaved throughout that strategy. Our great national task in February was to help flatten the curve, which we knew was inevitable globally, and to boost capacity at the same time. So we embarked from the outset on twin themes: flattening the curve, or containment, and capacity to boost our ability through our health systems to withstand the impact of the virus. And that strategy drew on the best available advice in Australia and around the world, but ultimately it was an Australian response to our own national conditions. The containment strategy had 4 pillars. Firstly, of course, the very reason we can't meet in person today has involved international border closures and the use of hotel quarantine to bring people home. It was the hardest of decisions, but taken at the earliest of times, with the 1st of February being the date on which we closed the borders with China, a decision at the time which seemed almost unthinkable, but in hindsight appears to be profound common sense and good judgment at a national level that helped keep us safe. But of course it comes at a great economic cost, we know that. But those border protections are themselves seeing innovations as we speak. We've opened a travel bubble with New Zealand. We're looking at other countries for that. We're looking at new models of home quarantine and home isolation, as we have when we travel between states and territories. I've spent 28 days in quarantine myself this year on 2 returns to Canberra, and it can be tough, but I've seen the way in which technology has been used to check up on people's health, their mental health, their compliance, and to make sure that passes and movements are done in a way which is as efficient as possible. All of which, of course, will be expanded dramatically and further still once a vaccine becomes widespread. And I can imagine that being, as with many countries, an important part of entry requirements for people from overseas, unless they were otherwise willing to go through hotel quarantine. But these are the things that will progressively open. The second part of our containment strategy has been our testing strategy. Over 8 million tests conducted. And the London School of Hygiene and Tropical Medicine has identified our national testing strategy as not just one of the broadest, but as one of the most accurate in the world. And that has been absolutely due to innovation and technology. New tests have been developed this year. We worked round the clock through February and March and April to make sure that Australia not only had long-term contracts for testing equipment, but that we were able to run an air bridge, and the work of the public service in collaboration with the private sector meant that we were able to bring those tests to Australia, distribute them, make sure that they were conducted to the highest levels. It was a fantastic example of an innovative public-private partnership backed by state funding for free tests around the country. We set up respiratory clinics, over 147 respiratory clinics around the country to couple what's happening in hospitals and general practices. And that gave Australians the capacity to be tested. And that testing leads to what we've done with tracing. We've had over 7 million Australians sign up to our innovative Australian app, the COVID Safe app. In turn, in just one case, for example, 544 contacts were identified, which otherwise would never have been known about. So then that brings me to the distancing. And of course, distancing is what we do when we know that the other elements will of themselves not be enough. And we've seen that in numerous jurisdictions around the world. And Australia's about maintaining safe distancing. We've had our difficult lockdowns in Victoria in particular, which has come with an enormous economic and mental health cost, but was a response once we saw that there was a breach in hotel quarantine and that the contact tracing was overwhelmed. But we've been able to rectify and strengthen those. And we're now progressively bringing down our distancing requirements. We'll still need to be COVID safe right throughout 2021. But that's the Australian containment story, which is seen as flatten the curve. The capacity story is about boosting the ability of our health system to respond to this great once-in-a-century challenge. We started out and we created a national telehealth system, which means that you could pick up the phone and no matter where you were, speak to your doctor, speak with your GP, speak with your specialist or your allied health provider. Already, we've had over 40 million cases of treatment through telehealth as we speak. And that means that an enormous number of Australians have been able to access healthcare from their own home. That is innovation in action. It was a decades-long proposal which we delivered in 10 hectic, frantic, focused days at the end of March, and it has transformed healthcare in Australia through the pandemic. More importantly, it's transformed the delivery of healthcare in Australia forever. That was innovation born of necessity. Allied with that is what we've done with the delivery of medicines. We've instituted electronic prescribing, which means that you can have a script delivered from the doctor to the pharmacist. But then we've coupled that with home dispensing, which means that instead of having to attend in person, the pharmacist can then, through using the electronic script, arrange for a home delivery, which during lockdowns or for elderly or for people who are immobile has been immensely important. So you can have your script delivered to home without ever leaving home. And what a transformation that's been. And you then couple that with what we've done in terms of innovation through the respiratory clinics, which will now provide not just testing, but play a huge role in the vaccine rollout. Much more importantly though, we know that there's been hardship and tragedy, but we've seen that the Australian Medical Journal has said that Australia's response has saved over 16,000 lives in Australia. And that's a critical step forward. That's a fundamental step. And so many people have played a part, but what we've done has assisted. That then leads to our hospitals. And Australia faced, as did so many parts of the world, the risk of running out of ventilators. So we made a decision in February to boost our ventilation capacity from 2,200 to 7,500 units. Fortunately, that's not been needed. But we did that by innovating and working with Australian firms such as ResMed and Grays to build that capacity for Australia, to have that ability to protect our population. And that's been done, and our hospitals have never been overwhelmed. And then finally, there is the great global search for a vaccine, and we're playing our part. We've invested over $360 million of Australian funds in Australian research for therapeutics, for treatments, and of course for a vaccine. The University of Queensland's molecular clamp is one of the world's leading vaccine candidates, and Australia has signed a contract for delivery and production in Australia of 51 million units. We're also participating in global contracting with the Oxford-AstraZeneca agreement and others in the wings and very close. And what that means is that we're part of that global search, both developing and providing here in Australia for Australians, but supporting our Pacific nations, supporting developing nations through the COVAX facility. And the world has never had a coronavirus vaccine. The world has never had an mRNA platform vaccine. And yet all of this is occurring because the structures for innovation have been put in place. Public support, private development. And that's an extraordinary contribution. And that is the story of innovation. We have, as a globe, suffered immeasurably, but we have saved lives and we've protected lives. And at the heart of that has been innovation. And so the world has taken leaps this year. So I want to thank all of you for that support in this most difficult of years. But I want to urge you on to say that this mission of competitiveness and innovation is more important than ever.